I don't remember, so I can't really say. But I might have looked into a little bit about like what the transitioning process is like going from female to male, and I might have looked into a bit about the hormones that they take, things like that, just so I wasn't completely clueless or insensitive to the situation. It definitely wasn't a lot of preparation, but I think I did something just so I kind of
Yeah.
I can process what they're going through.
Yeah. And sorry, you're cutting out a little bit. Could you talk just like a little louder?
Sorry. Okay, I'm ready.
Okay. Thank you. And how did you handle specific terminology or pronouns?
I don't remember, and I'm trying to be really careful about it now, but I think it's different when you have someone in front of you because you're saying you as opposed to he, she. And honestly, I think there was so much awareness around the whole Caitlyn Jenner thing that I think that might be why now I'm calling the patient a him, whereas then I don't know what I would have done. I don't remember it really coming up or me like stepping over, stepping over my tongue or anything like that. I think it's just when you have someone in front of you, you're calling them. If you test positive, how are you doing? It's not you is generic, which I guess is good.
Yeah. And so in your note, did you use he pronouns?
I think I did. And I also think when I actually remember consciously when I sent the patient the results and the letter, the follow-up consult note in the mail, I addressed it to, Mr. So-and-so, especially because I wasn't sending it to his parents' house. He wanted it to go to like a friend's house or something like that where he was basically living.
Right.
I felt like I could call the patient with the pronoun that they wanted to be called.
Yeah. And do you remember if his medical record was under male or female, and if he had like a male name in it, or if it was
Really
his
good question.
first name?
I don't remember. That's a really good question, though.
Okay.
If the record was written in female, then it was definitely made clear in the record that the patient was transitioning to male, though. I don't know how the patient was referred to, but
yeah. And how did your patient's identity as transgender affect the information you gave him regarding his cancer care?
yeah, again, I think it was just like I had to reshift the focus a lot and just make sure that the main points were understood in terms of other implications for the test, aside for just getting insurance coverage for the surgery that he wanted if positive. So I think I just had to kind of, and by the way, BRCA2 is associated with pancreatic cancer. So like it's kind of like you want to cover all your bases even though you know that the patient doesn't really care at this point.
Right. And did the patient seem comfortable talking about things like breasts and ovaries and uteruses?
Yeah, I actually think more so than most 20-year-olds, just because obviously I wasn't the first healthcare provider that they were meeting with to talk about this stuff. So yeah, completely.
Yeah. And I know when we're talking about like BRCA, for example, often genetic companies give risks like for males, there's a whatever risk of whatever cancer. For females, there's whatever percent risk. Do you remember how you framed that for this patient?
I don't think I don't remember, but I don't think I gave specific risk figures, risk estimates. I think it was more just if you test positive, that means that you have an increased risk for breast cancer, ovarian. I don't think the patient was like in the mindset to really hear about all of that or was really interested. I feel like I try to really quote numbers when I know that a patient A wants to hear them, is asking about them, or B, I feel that they are concerned about it. This patient, it was like that if they test positive, it's almost going to be a relief as opposed to a detriment to them. That I don't think I had to, I'm sure I did not quote specific risks because it doesn't really matter knowing that he now has an 87% lifetime risk for breast cancer. Okay, he's going to have the bilateral. It's like I know what he's going to do with that information.
Right.
So, I'm sure also had the test come back positive, we would have taken the time to go into a lot more detail, and, the breast surgeon as well would have probably reiterated a lot of that. But I don't think I went into as much detail about risks as I may have with other patients.
Okay. And do you remember if you ran into any differences administratively with the patient, like pedigree differences, insurance, medical records, PRF forms?
Not that comes to mind, no.
Okay. And how did you write this?
At the time, we were using paper charts, so it's not like that you have to check off male or female on, a EMR or anything like that.
Yeah. And how did you write him on the pedigree?
I should have looked. Knowing me back then, I probably drew a circle and then probably wrote transitioning to male.
Okay. And how would you do it now? Would you do it any differently?
Well, now there's all this, there was this post on the listserv a couple weeks ago about, drawing a square within a circle or a circle within a square. So I think I would have, looked in terms of what actually is the most appropriate, way to draw it.
Yeah. And switching gears a little bit, do you have any experience or personal relationships with anyone who identifies as transgender outside of work, like a friend or a family member?
No, I didn't.
Okay. And how about just a friend or a family member who identifies as LGBT in general?
Yes.
Okay.
Although, I don't know. To me, they're completely different categories, so I don't know that necessarily played into my perception in any way.
Yeah. And would you say, are you comfortable with people who are transgender? Or?
Yeah, there was nothing about the appointment that made me uncomfortable, except that as a genetic counselor that you just want someone to kind of understand in a lot of detail, the tests that they're having and the implications. And I felt that the patient was a little bit kind of nonchalant about the whole thing. But,
Yeah.
20 years, that was the reason for the test, and it is what it is. But, no, there was nothing about, the psychosocial situation that made me uncomfortable.
Okay. And do you remember if your GC training program had any training on transgender-specific issues?
No. I mean, this is also, I graduated in 2012. Yeah, 2012.
Okay.
So, I don't know. I feel like there's been a lot more awareness, within the last couple of years. Maybe.
Right. Yeah, and you mentioned, Caitlyn Jenner and...
that's huge, So maybe now they do have a bit more training or awareness and programs, but back in my day, not to date myself, but
back in your day 5 years ago.
Exactly. I don't remember talking about it too. I mean, I'm sure it came up, but not like a seminar or a lecture or anything like that. That would be interesting, though.
Yeah. And how about, again, LGBT issues? Did your training program have any training on that?
Again, so long ago, I don't remember anything formal. It might have been something in your clinic that you saw, as a student, or something that came up, or a case that you were given to present, or something like that. But nothing formal that I remember, at least.
Yeah. And do you know if your job or hospital has any training on transgender issues?
I don't think they do.
Okay. And did you seek, I think you talked about this a little bit, but did you seek any training or extra resources before or after you had your patient?
No, nothing in addition to the little prep that I might have done.
Yeah. And if, what would be the most helpful thing for you to have if you were to look for a resource? If you could find a sheet of paper with all the different information you wanted on it, what would be good for you to have on it, having to do with transgender issues and cancer?
Huh.
Or
That's
just
a really good question.
genetic counseling?
Definitely how to draw it on a pedigree, if there was some standardized way, and maybe I just don't know it, but that would be helpful. No, I mean, I think in general, just maybe, I think it's important, what you're doing is, you're interviewing providers, but I don't know if part of your research is also interviewing patients, but what their experience has been, just so that we can kind of make our counseling better and more appropriate and more fitting and more sensitive to their needs? Like, obviously, I